Most venous disorders are rated under Diagnostic Code 7121 in the Schedule of Ratings for post-phlebitic syndrome of any etiology. A veteran's rating is based on the severity of their symptoms. The VA will evaluate your condition based on the level of swelling, discoloration, vein hardening, and leakage or discharge. The VA rates venous diseases based on the following findings and their corresponding percentages. For 100%, you'd have to see massive board-like edema with constant pain at rest. For 60%, you would need to experience persistent edema or subcutaneous induration, thickening of the skin or under the skin, or stasis pigmentation, which is discoloration, or eczema and persistent ulceration. This would be referring to recurrent problems with wounds. For a 40% rating, you would need to experience persistent edema and stasis pigmentation, or eczema, with or without intermittent ulceration. For a 20% rating, you would need to experience persistent edema, incompletely relieved by elevation of the extremity, with or without beginning stasis pigmentation or eczema. So elevation of extremity for relief, a good example of this would be if you're experiencing swelling in the legs, maybe you lay down on the couch with a couple of pillows underneath your ankles. If that doesn't fix the problem or it doesn't relieve as a result of you putting your legs up, then you'd fit into this category. 10% rating, you would need to experience intermittent edema of extremity or aching and fatigue in the leg after prolonged standing or walking with symptoms relieved by that kind of elevation, or compression hosiery. A 0% rating or non-compensable rating would be an asymptomatic, palpable, or visible varicose vein. These evaluations are for involvement of a single extremity. If your venous conditions affect both sides of the body, the VA will apply the bilateral factor.